Which of the following mechanisms best explains how hepatitis C virus evades host immune defenses? All right, they tell me exactly what I need to know. It's about hep C. I don't care about any of the other hepatitises, HIV, whatnot. This question is about hep C. A 35-year-old man, he's here for persistent fatigue and right upper quadrant discomfort. He has a history of IV drug use, but has been sober for the last year. His LFTs, or liver enzymes, are elevated, and they tell me serologic tests are positive for hep C antibodies. They do a liver biopsy showing chronic hepatitis. The most common form of hep C is chronic. The physician explains the virus is able to persist, like we just talked about, due to its ability to evade the immune system. So what mechanism best explains how it evades the host defense, which is response 2? So number 1, inhibition of MHC class 1 antigen presentation. I'm going to be honest with you, I don't remember that. I don't really remember which viruses do that. Maybe herpes. Again, I don't know. I'm not 100% sure, so I can't rule this one out yet. Antigenic variation due to lack of proofreading and RNA replication. In that sketch, I remember the little hippo sitting in the water. There's something about swimming, but it's spelled wrong. That makes me think that there's something to do with proofreading because I remember it's like swamming or something. I like grammar, so I recognize that it was spelled incorrectly. So maybe this. Integration of viral DNA into the host genome. That one is the retroviruses like HIV. That one I know, and I can rule that one out definitively. Production of a viral capsule resistant to antibody neutralization. So hep C has a capsule, but typically capsules are more for like pathogenicity and not evasion. So possible, but less likely for me. And then last but not least, we have latent infection of sensory ganglia. So I remember this one, varicella does this. This is how it causes shingles. And I want to say tetanus, but I'm for sure on varicella. So it's not this one. Capsule, again, more for pathogenicity and not necessarily evasion. Not really integration, this is HIV. And then I'm really between A and B here. I do remember something about B. And when I come into a 50-50 and I don't really remember this, that well, if I have that little brain blast or anything like that, I'm gonna go with that answer. So I definitely think it's this one, and let's find out.